and welcome to our Dominate Healthcare podcast. I'm Dr. Ben Lerner, and we're excited today because, as always, I never have more fun than when I'm doing this with my brother, Dr. Erik Lerner. Hey, Dr. Erik.
Hey, you never call. It's good to see you.
Yeah, this is about the only chance we get together. Yeah,
It's
Erik has
shocking.
17 children. Erik has children. They're all 6 months apart. So it's not sure how that happened. So we go way back. So Dr. Erik, when I first was practicing, so we had gotten Kissimmee up, we're up seeing 1,000 a week. You get out of school, you get licensed and come down and start working with me. And very quickly, not only were you helping us grow the heck out of Kissimmee, but we opened up a St. Cloud clinic. Then we opened up a Metro West clinic. So very quickly, we had 5 clinics going in Central Florida, and that erupted into a coaching program, and it really took off from there. But we've always had this one mindset or one way of doing it that we're going to share with everybody today, which has been very low overhead. So it's been as few staff as possible, and often many cases like you're going to share today, one staff. So seeing big numbers. I mean, your clinic has been as big as 800 a week. Now you're running a tighter ship with higher quality patients that are there for a very long period of time. 20 years plus is the average lifespan of your patient in your clinic. I shouldn't say lifespan or numbers of visits, they're there over 20 years, but still one CA. So we've always had that mindset, like 1,100 square feet, 1 or 2 CAs. So when we talk about the money we make and the volume we see, the overhead's really small, so that profit is really big, and you get to bring it home with you.
Yeah, I'm on this podcast with you from my office in my office, and I had to clean up a bit because it doubles as a storage closet. So I got everything else behind me out of here. But yeah, so I've been in practice 30 years. Like you said, I've seen up to 800 a week, and we always did it with one person. And I think so. First and foremost, for anybody listening, is that we know it can be done, right? We've done it. I was talking to my wife Cindy. She, for a period of time, was my CA, and I was telling her we were doing this podcast today, and she was fantastic. And one of the things she brought up is at the time when she was running this office as the CA, we were not dating or anything like that. Maybe she had a thing for me, but we weren't in love. What she said is, I really loved chiropractic, and I loved what was going on in the practice. And so really everything I think that we'll cover today, if you can get to the point where your one CA loves chiropractic and loves what the practice is doing, is that much on mission, you probably don't even need to listen to anything else that we teach today, because it can be just fine.
So I don't know how you've been in practice for 30 years. I'm the older brother, been out of school longer. I've only been at this like 15 years. So I don't know how your math is getting to 30. Yeah. So that's a great place to start. In fact, I always tell a story about Cindy that you know what I'm about to talk about. So Dr. Erik's clinic, again, with one CA. So you're seeing huge volume at the time, 700-800 a week, one CA. And you were famous for the fact that every single patient made it to the doctor's report with their spouse. And that's always really a challenge for most clinics, that you guys are doing it all the time. In fact, you used to say it's not a chiropractic clinic, it's a spouse of the doctor's report clinic. That was always a great teaching of yours. But I actually called Cindy up one day. So I said, what is it that she's doing? Because nobody's getting those kind of results. And so she walks me through the process, and the process was the one that we were teaching and that most everybody does, yet you guys are getting 20, 30% better results than everybody else. So finally, I'm like, well, I guess there's nothing different than you're doing there than anybody else does. And she closes with, yeah, the only thing I can say is I love the doctor's report. That is the most important visit anybody could ever have in their entire life. And there it was. That last statement by hers, just like you said, she loved chiropractic. She loved what you were doing in that office, the impact it was having on people's lives. Obviously, if she loves the report, she loves the philosophy and the principle and the meaning behind chiropractic. So that's a great place to start. So how did you get her, and how have you continued to get all of your CAs that focused, that committed to chiropractic?
You need to put a strong commitment into the the teaching and the motivating of your team, right? So we meet regularly. We talk about the struggles going on in the world with health and healthcare. I make sure that the things that get me going as a chiropractor, when I see something about, nowadays masks and vaccines and all that, the stuff that boils my blood, I make sure we have those conversations with my team, because more important than a patient getting the big idea is my team of one getting the big idea, because what we were just talking about. So just really pouring into them and not thinking I don't have time to do that because I have so much to do to teach my patients or work with my patients. Nothing's going to happen with your patients if your team isn't taken care of. So I've heard you say this before, that the most important adjustment that you give each day or each week is to your team and your family, right? So if your team and your family are on board, everything else is going to work out just fine.
Now, I hear a lot people say, how do you motivate the team? How is your team so excited about chiropractic? As if there's sort of one thing I do that I say this and bang, they're just excited, committed, and that's it forever. And then what I learn is I ask those doctors more about why their team isn't all that fired up. You find out that there's no consistency to their meetings and interactions. And I'm always surprised by that, because I've always felt like I can't wait to get to that next huddle or team meeting or strategic session with my team, because if I don't, I know they're going to fall apart, leave me, come in unmotivated, incapable of executing. So what's that look like for you? Because obviously they're not just showing up all fired up and excited to hear about all of your adventures in chiropractic. What has the structure been like? And how do you overcome the fact that obviously they're having bad days? So 3 out of 5 shifts they come in for, 60% of the time, they're probably having a bad day of some kind, or they're stressed out about something that has nothing to do with the clinic.
All right. Well, you throw me 2 questions at once. I have a hard time remembering. So if I don't remember the second part, get me. So the first part, with a patient coming in, a patient comes in, they're not excited about chiropractic, right? And so we have, processes and procedures to help educate them to become excited enough to commit to long-term care. And so one of the big things within that is that at the doctor's report, we share stories with patients, right? We're showing x-rays of people who were suffering. We talk about what they were doing before they came to our office, right? So here's a person, on such and such a medication, scheduled for surgery, just depressed, unhappy, and then came here. We took this x-ray. Here's what we saw in terms of the subluxation of the spine. We started addressing that, and now the person's off all the drugs. Their health problems are gone. They're doing great. And that story gets a patient excited enough to say, you know what, I'm done with the drugs. This makes sense. I'm going to follow you. Well, that's the way I get my team to get excited as well. That is in the training, which does have to be regular. We're meeting every week, and we're training on this. But in that training, it's showing them x-rays. It's showing them people who were suffering, talking about their stories, what they were doing before they came here, talking about what we did here, showing them a post x-ray. Look what we did here for this person, and here's what they're like now. Now at the CA, I can even say, Mary, who was in earlier, Mary's pretty great, isn't she? Yeah, she's the best. It's like, well, listen, Mary was a nightmare when I met her, right? But let me tell you what she was going through. Now look at her. And Mary has grandkids. Is she going to be around for her grandkids? Yeah. And so you get your team fired up that way. Now, the 3 out of 5 days that aren't such great days at home, and they're coming in all in a bad mood, pretty much, my CAs are mostly, they've been younger. And so I found every Monday, when you say bad days, every Monday is tough. But we do huddles before we start the day. So I know they're maybe not ready to go. Maybe they're not excited to be here right now early on a Monday morning. And so I don't just pretend that's not going on, or just try to hope it goes well. I have a little Monday morning motivation, a Wednesday morning, Friday morning motivation. Every time we start a day, start off with something to get them ready for the day, and to acknowledge what we're all going through at home, right? I don't have to say, come in the morning and say, you know what, man, my kids yesterday were rough. They didn't sleep last night. It's, it was brutal. My 14-year-old daughter is driving me up a wall. I'll share that and then say, but we've got Mary coming in today, and we've got Joe coming in today, and these people need our help. And so when they come in here, when they ask me how I'm doing, I'm going to tell them I'm doing near perfect. Just like Dr. Sid taught us. So you just got to get them each and every day, acknowledge what they're going through, but get their heads right to take care of people.
Yeah, it's back to what I was saying earlier when people say, what are you doing to fire up your staff? It's really what we're doing continuously or consistently. So it's huddling before every shift. It's meeting every single week. It's having strategic sessions every month or at least every quarter. It is like what we always have said about motivation. Motivation's like brushing your teeth. It only works if you do it twice a day. So you've got to continuously inspire these people if you expect them to build an inspiration over time. Now, anything more to the fact that somehow, though, you're only needing one person. So I was on the phone today with somebody who, good, because there was somebody who contacted me just today and said, we have 6 staff. And so they have 6 staff, and their practice is exactly your size. So somehow they require 6 people and an extra doctor to accomplish what you're accomplishing with one staff person. So give us a bit about that.
Yeah, so the staff person's I call it like the drag on the staff person, or the pull or the need for them in terms of the work that they do during the shift is really dictated by the patient's needs, right? How much support does a patient need visit to get through the visit, to stay on track, to schedule, pay, all of those things. And so our processes and our procedures and our patient education has to help set a patient up to where they don't need a lot of attention visit to visit. In fact, unless something's off, there's some I would call it not a typical need, a once in a while need. There really is no need for the CA and a patient to have to communicate during a visit. And so I'll give you some examples. It really for us, I would say if you look at something like the doctor's report, right? So doctor's report for us is where we're going to show a patient their x-rays and and also educate them on what a subluxation is, what care looks like. And when I'm showing someone their x-rays after we've done the speaking part, I want to make sure that patient understands what the actual problem is. What are our goals for them in the practice, right? And our goals are not necessarily to take away their headaches or their back pain, but to correct what we're looking at on the x-ray in front of them, right? And so if a patient understands that, give me 1 second here, sorry, I've been a little symptomatic lately, but if a patient understands exactly what's going on the x-ray, then I can say to the patient, okay, so you see you see the problem, are you committed to taking care of this? They give me the yes. Before we leave the room where I'm showing their x-rays, I then say, well, let me walk you through what a visit is going to look like, right? When you're in the adjusting room, each time I see you, on your x-ray, you have a problem here and you have a problem here, right? Those are 2 spots. Do you see that? Yes. So when you come into the room, I'm going to adjust here. There's an adjustment I do for that. There's an adjustment I do for this, right? And then we're done in the room. Does that make sense, right? So those 2 adjustments might take us, and I always shoot low, right? So someone like you seeing 2,000 a week, you're probably in the room 8 seconds. But for me, I'm probably in the room with someone now in my older years, maybe 2.5 minutes, but I'll tell them a minute, right? To make those 2 adjustments, it's going to take about a minute, right? And so now my patient understands why. It logically makes sense. Okay, you got to adjust that and that. That takes about a minute. When I give them 2, I'm doubling their time that they were expecting. But that they know what to expect in the room. When they go up to the front after the doctor's report, we set up all of their visits for the first 60 to 90 days in advance. We also set up their payments in advance, right? So either paying in full or maybe on a payment plan where there's a credit card on file. That is all set up. Excuse me. So they don't need to stop every visit to schedule. They don't need to stop every visit to pay. That's all taken care of. And then lastly, at the front, my staff will do the same thing I did. They're going to walk the patient through what a visit looks like. So when you come in, here's how you check into the office. They teach them that. There are some warm-up exercises that we do here. My staff teaches them. So you're gonna check in here. You're gonna walk to this part of the office. You're gonna do these 2 exercises. You are then going to grab a number, and you're going to wait for a room to open up. And you're gonna when it does open up, you're gonna walk into that room and lay down. Right when you're done, there's one more exercise we're going to teach you. You'll do that, and then we will see you next visit. So they have their visits already scheduled. Their payments are already taken care of. When they come to the office, they know what to do. They've been walked through that process. And my staff lets them know, hey, if you ever have any problems, right, you're confused about something, by all means, stop and ask me. If you have an issue where maybe you need to reschedule or you have an issue with a payment coming up, stop and ask me. I am here to support you in every way possible. But typically you'll walk in, get yourself checked in, do your warm-ups, get your number, get adjusted, do your post-adjustment exercise, and then we'll see you the next time. And so, again, do people sometimes need to reschedule? Yeah, but if someone's first care plan, let's say it's 40 visits long, they're not going to need to reschedule 40 times. It might be a few times over those 40 visits. Are there times where someone needs a little help with changing a payment date or something like that? Yeah, but it's not every payment. It's a here and there thing. It just cuts down completely on what the CA needs to do during the shift. And so really, it allows the CA during the shift to focus on things that like recalls and maybe making flyers, maybe a little bit of help here and there with someone in the rehab area or with a reschedule. But their time is so freed up that they've got plenty of time to do many other things.
And the point is, you're doing a lot of volume. People are staying with you record lengths of time. They're staying with you 20 years plus is the average in your clinic. There's corrective care going on. So realize people are on a corrective program. So this is not, meatball chiropractic or like a mass unit. People are going through tractioning, they're going through spinal rehab, they're going through wobble, they're doing Vibe platform, and people are doing all of this. There's supplementation going on. So this is not, your typical sort of maybe old school high volume practice, yet because you've put structure to it, we've only needed one person. I think that's maybe one last thing you might have to say on that your commitment is still to high integrity, high quality chiropractic care. It's not what people might think that requires only one team member.
And if someone needs more time, typically, maybe from me. So in fact, when we're done here today, I've got someone coming in who's a current patient who's definitely not completely getting it. And so we have time we set aside. It's just before, after shift. All they have to do is ask, or sometimes, like in this case, I recommended, hey, let's take some time on your next visit. I'm going to have you come in early, and we'll have all the time you need to talk and walk through this.
Yeah, agreed. Yeah, extra stuff can be a phone call scheduled outside of time, but adjustment times are for adjustments. And yeah, love everything you've said. I've always been aggressively committed to the dream practice I want, but what I've dreamt has to be structured, and there needs to be a commitment to a process. And what I've seen alternatively to a lot of practices that need more staff is the patients truly are running the asylum, and it really does become a nut house, driving chiropractors, their spouses, and their staff crazy. And we need a lot of staff to run it because it's crazy, not because it's so big and voluminous that we need a lot of people to get the help done.
Yeah, if they understand what the problem is, right? And if you as the doctor are not making it about you, or you're healing them or making them feel better, it's about the subluxation, right? About what are we actually working on? It sets up a patient who understands why, right? So, okay, yeah, the adjustment shouldn't take long. You have to do all these other rubbing my back things or whatever. Stretch me. One time I covered for you when you were at one of the Olympic Games, I think Atlanta. So it would have been 96. So
Yeah.
I'm a little bit fresher in 96. I graduated in 93, and I go to cover for Ben. I walk into a room and I kind of like start tractioning the patient's back out. and kind of like start palpating. And the guy looks up at me and goes, "Oh, you're going to play the piano today, huh, Doc?" And he's like, because, Ben had him educated. I'm going to walk in here. You're going to be, I'm going to adjust here and I'm going to adjust here, right? And I went in there and started playing piano. So you need them to understand even something like the numbers. We explain up front why the numbers, right? So some people might look in office 2,000 a week, even 800 a week, and say, is it a factory, people just going through? Only if they don't understand what's going on. So we up front, hey, listen, this will help make this smoother for you, right? When we don't have numbers, I'll tell you, in my office, I've had patients like fighting with each other, not fists, but yelling and stuff. The numbers make it so that it's just very smooth and easy for you to get through the visit. So it's all about them knowing why and understanding and making logical sense of all of it.
Fantastic. Well, thanks for listening to Dominate Healthcare. Try to get to one of our events. You can visit us online. We've got a December 8th and 9th Dominate Healthcare event where Dr. Erik will be one of our speakers. So if you're looking at tightening up the staff, increasing your profits, and just having a much better quality offering where people stick around for 20 years plus, you can hear Dr. Erik here in Orlando. Thanks, brother. Talk to you soon.